And I will just note, I think Senator Akbari is like 10 minutes after presenting the bill at the legislature, so we're just grateful to have her here. Thank you, Mandy, for providing an overview of all of the work that is currently happening in our state, and really want to turn to this panel of state leaders to reflect on how that work is playing out in our state, what we should be proud of and know about, and perhaps where the work should go next in Tennessee specifically. So I want to start maybe with a bit of a broad question, and I might ask Commissioner to start, and then maybe to Brian next, and then Senator, and then Director Sparkman. But maybe broadly, when you think about all the work that Mandy just presented and that we've talked about this morning, what are you most proud of in terms of the work that Tennessee is currently doing around student mental health? Commissioner, I'll start with you.
Thank you so much for asking that, and really appreciated what Mandy had to say earlier. I could not be more proud about what our governor and legislature have been doing over the last 6 years related to kids' mental health. In doing that, I'm going to ask some questions to the audience and include you. First, how many of you have ever heard of the school-based behavioral health liaison program? Could you raise your hand? That makes me so happy. I used to ask that question and maybe 2 hands went up. That program is phenomenal. If you look at school resource officers being put in each school, which looks at physical safety, this really is our plan to put a school-based behavioral health liaison in every school, looking at mental, emotional well-being, right? So that's our goal, and since Governor Lee and this incredible legislature have been in office, we have expanded that program from 14 liaisons to 274, with even more being introduced into this budget. That's one thing to be very proud of. Second thing, how many of you have heard of our mobile crisis teams that operate 24/7 that you can call 365 days a year? Would you raise your hand? Mobile crisis teams. Thank you. All you got to do now is dial 988. 988. Somebody's going to answer to help you. If you've been watching the games, NCAA championship tournaments, you will have seen a bunch of ads that are being targeted towards kids, middle school, high school, that are having concerns. 988 is a huge expansion that we've done, again, under this legislature and governor. The next one is the safety net that Mandy alluded to. How many of you have heard of the behavioral health safety net for kids? Raise your hand. Please go home and look this up when you get home. This is for uninsured kids across the state, connects them up to a community mental health center. It's a 1-page application, 1 page, and that child can access the services it needs. In our state, about 95% of the youth have insurance, either TennCare or private. This is for that 5%, so that when you're in your school systems or you see a youth in need, you can access that. It's phenomenal. The next program I would say is our crisis stabilization units. When we started in this administration, we had 0 kids crisis stabilization units, 0. Today we stand with 1 in Knoxville that has been so successful that the governor and legislature are allowing funding to create 2 more, 1 in Nashville that's about to be announced, and 1 in Memphis. This is a place where if kids are really struggling and need stabilization and don't meet commitment criteria, that they can go there for up to 5 days to get the help they need. Those are being run by our community mental health providers, through which we couldn't do anything if we didn't have them. And then finally, I'll just hit on our mental health ambassadors across the state and college campuses, where we know that there's a huge increase in concerns for youth, kids going to college, and we've expanded that program. In the audience is our Assistant Commissioner of Children and Youth Services, Beth Goodner. If you don't mind standing up, Beth, if you have any questions, feel free to contact her. She's here today. Thank you.
Thank you, Commissioner. All right, Senator, What's top of mind for you around things we should be proud of in Tennessee in this space?
Well, I think first and foremost is that the General Assembly is starting to recognize it's an issue, right? I think you have a lot of folks who say, you know, I went through all sorts of things and I turned out just fine. And I think recognizing, hey, you know, this is important, it's something we have to get right. It's a meaningful opportunity to intervene when these folks are young, when they're children. They really can set them up for success. So that's something I'm happy about. I remember last year we had a group of kids high school students who presented a bill about allowing a mental health day in high school. And you think it's very straightforward. I mean, you know, parents do it on their own, at least allow it to be approved. And my colleagues just were beside themselves. Like, what, a mental health day? Are you serious? Go to school, take your mental health day on the weekend. Like, that was a real comment. Obviously, the bill failed. But I think, you know, having those conversations, recognizing, hey, you know, we just encountered something that most people, at least for generations, will not encounter, and that's a pandemic that, you know, and our young people suffered in ways that, you know, sometimes we're still finding out from being isolated, being at home, seeing this increased reliance on an online community, potentially leaning into dangerous behavior. And you know, I think at one point we were more so focused on the physical, we didn't really think about the mental. And so for me, I think on a most basic level, obviously as our esteemed commissioner, who is just one of the jewels of this state, said, you know, we've put money into programs that are really important to help students, but a lot of that comes from the governor, and so and from your department, your agency. We have to also make sure that the legislature understands the importance of legislation and other programming as well, and I think they do. I mean, obviously we pass the budget, that's our only constitutional duty, but I still think putting ourselves in the shoes of students, it really, and more than just mental health, would really go a long way. Because I graduated from high school 20-some years ago, and I'm the youngest one on the committee. So if you can imagine how my counterparts, when was the last time they saw a classroom? So I think that makes a difference.
Great, thank you, Selina. Dr. Noland.
I think I want to pull back and look a little bit about the impact that this has on the lives of students. You know, East Tennessee State University is an institution in Northeast Tennessee, 14,000 students. Of those students, 40% are Pell eligible and 40% are first generation. So just within those two data points alone, our students are bringing a series of experiences that are learned experiences with them to the university. We have put in place a series of initiatives. We want to be the nation's first trauma-informed campus. We're fortunate that we have a broad portfolio of health sciences programs at the university, counseling, social work, psychiatry, psychology, all of which have individual clinics that are available to support the needs of students. But I've had the chance to be in classrooms and to see students who are struggling post-pandemic. But one thing that the pandemic brought to bear in a way that I think was unique for us is that students are now no longer afraid to ask for help. And the demand for support services in the counseling center and then across the centers run by the programs in the health sciences is just overwhelming. We saw more than 4,000 individual students last year. We have 14,000 students total. So we've opened the doors of opportunity for students to seek care, and now we're looking to rewire the institution so that first input may not be with a counselor, maybe with a peer. So how do we provide the peer support for those individuals so that they have the certification, skills, and training? And it's not just us. One of the things we're really proud of is the work we've done with Ballad Health. Ballad, through more than a $10 million investment, has created the Strong Brain Institute at our campus, which brings together an interdisciplinary team of experts to help build out support services, not only for us, but for our partners in P20 and in the healthcare space.
Great. All right, and Director Sparkman, and I might ask, if you don't mind, in your answer to this question too, maybe tell us a little bit about your community that you are serving in as well.
So we're one of the distressed counties in Tennessee. High unemployment, a lot of mental health, and that really came to the forefront more so during the pandemic, because one of the things that we really haven't talked about is that a lot of our children lost parents. They lost grandparents who they were living with. And so this pandemic really came to the forefront for them. So we're still seeing a lot of the mental health issues within our classrooms that are based from that. It is more apparent. But I am proud of Tennessee for making this one of the priorities that our state has. We've been able to get about $7.5 million in grants and in kind. We don't have a lot of community resources. So when we're looking at tier 2 and 3 students, we have to try to find some place for them to go. And I'll talk a little bit more about the resources that we're trying to do for them. But we have really poured a lot of money into this because, we have Maslow's hierarchy of needs. And if we want to educate students, we have to look at the whole student. What are we doing for them nutrition-wise? What are we doing for them safety-wise? If you don't feel safe, you're not going to sit in a classroom and want to learn. And when we look at the health needs, it's not just the physical health, as someone said previously, it's also the mental health.
Oh, great. So we heard earlier, I think Dr. Shim just elevated how important it was to hear from students and student voice and elevate students in this conversation. And thinking about the fact that I know Dr. Noland and Director Sparkman, y'all are working with students literally every single day. And so maybe would love if you could ground us in a story that may be top of mind for you around supporting positive student mental health or student well-being that maybe sticks with you or is sort of front of mind for you as you're thinking about some of these issues. And Dr. Noland, I may start.
Well, I think two. One is prior to the pandemic, our Student Government Association brought forward an initiative to increase fees. Now, it's rare that students want to impose a fee increase upon themselves, but this was championed by our student body president, who recognized the needs across the institution. And from his advocacy, we've been able to put forward a series of initiatives from enhanced clothing closet, enhanced food pantry. We've partnered with Sodexo, who is the food service provider on campus, to provide additional support services there. We've increased the number of counselors on campus, but we've really put a focus on well-being, life skills, and ultimately technology. And that technology component is critical. We have a platform called Navigate that provides a triage of care both on the academic side as well as on the mental health and wellness side. So through our Dean of Students, we're able to see if a student hasn't come to class 3 days in a row, then we can reach out to that student, get a sense of what is moving, and sometimes what's moving is that student is struggling with mental health issues. So all of that came from the leadership of our Student Government Association, who looked to impose a fee upon themselves to broaden and support the services across the campus. But now, how do those services impact the life of a student? I'm still foolish enough to think that I can play pickup basketball. So Sunday evenings I play with students, and there was a Sunday evening that I was playing and there was a young man who's normally there who wasn't there. Next day when I got to work and I saw the police report, I saw that this individual had been admitted for care because his roommate had called and identified that this young man was demonstrating symptoms of suicidal ideation. So as we wrapped support service around this individual, we found that he had an ACEs score of 6. And first generation student from Chattanooga and was really struggling with life. As a university, we were able to ultimately provide some support for this student who ultimately got his bachelor's degree, his master's degree, and now he's working in the higher education space in the city of Cincinnati. And every time I see him at homecoming, I'm reminded of the fact that this is an example of a system that worked. So, one of the beauties of being in my capacity is the chance to see systems and then how those systems impact people. And that's an example of one we got right.
That's great. All right, Director Sparkman, I'm sure you have many stories that you could share, but maybe one that stands out to you.
Yeah, so we have one particular student who has not been able to eat in the cafeteria since probably his first years in elementary school. He has high anxiety, he's autistic, and we've tried several things with him, but we have a group that came in known as the AWARE grant. It's based off a grant that we received, but it's the AWARE project. And so they've worked with him 2 to 3 times a week in a period that we call warrior time. Our students are allowed to go into tutoring and things of that sort at our high school. And so he goes to the AWARE group, and they have been working with him on skills and continue to do so. But at this point, This young man is going into the cafeteria and eating with his peers. He also was afraid of the fire alarm. Now he goes out with the other students, and one of the things that he told me, it's because he knows that he feels safe. People are coming to check on him. And his mother shared with me that before, when she would take him to church, he would hide out in the bathroom. Now he's actually in with the congregation. It wasn't that he didn't want to hear the sermon, it was just that he didn't feel comfortable with other people. So, I mean, this is just one student, but we're reaching a lot of students within our school district that we would not have reached before if this had not become a priority.
So thanks for sharing about Project Aware. I know that's one of the projects that your district is focused on and implementing. We also heard at the sort of state level the work around coordinated school health, the investments there. Commissioner talked about that a little bit as well. But would love for you to talk about how that work plays out in your district specifically. What does that look like? How does it play out on a daily basis? We'd just love for you to share a bit about that.
So it's enabled us to hire a social worker and also other people who are really focused just on the mental health of our students. As I said before, we are distressed county. We do not have a lot of community resources. Our parents have to drive to neighboring counties to be able to get the resources that they need. So Project Aware has really helped us to zone in on, is a student tier 1, 2, or 3. If they're tier 1, then we can help them right there. If they're tier 2 or 3, we set up telehealth on Fridays, and they're able to work some of that out through the telehealth when their parents can't drive them to one of the local counties. So it's been a huge resource for our district. We started out in the first year with about 140 students. We still have 2 months roughly left of school, and we're at about 400 students that are being helped through Project Aware. And let me just state, this is going on my 3rd year. I'm actually from the Memphis area, and to me, poverty is poverty. It might look just a little bit different. In Memphis, our kids had transportation. In Bledsoe, we don't have transportation. Mm-hmm. So it makes it hard for our parents to get our students the help that they need, both mentally and physically. So these resources are imperative for our students and the success that they will see. When I went to Bledsoe, our middle school was 3rd from the bottom. We were not academically successful. This year we came out as one of 12 exemplary school districts in the state of Tennessee. Awesome. We're a level 5 school district.
Well done.
And 4 out of 5 of our schools came back as reward schools. So yes, we are academically inclined now. But I truly believe that academic success has come through also reaching students physically, their physical health, their mental health, and their nutritional health. And we have a great team who works on that.
Well said. Thank you for your leadership.
Thank you.
Commissioner, you gave earlier a list of all of the different things that are top of mind for you right now. And I'm wondering if you could sort of elevate 1 or 2 things that you're thinking about that the state is focused on, aimed at expanding access for mental health supports for students, and particularly, given the conversation we've just had, our highest need students in the state, whether that's students in rural communities, economically disadvantaged students. Would love for you to talk a little bit about what's
Well, first off, I just want to say you are so spot on with what you are saying. I really like Dr. Sparkman. I've never met you before. She talked about the issues because of the pandemic and kids seeing their parents and grandparents die. At East Tennessee State University, Dr. Wyckoff put out monthly the research around anxiety and depression with youth and adults in the state, and it went up to 40 to 50% at the height of the pandemic. You're spot on about what you're saying about that. Number 2, the fact that you're able to demonstrate that when you focus on the whole child, I mean, you've just done that in a 3-year period. Did y'all hear that? A 3-year period. That's what we've got to do. So when you ask me what is it that we're excited about, it's the school-based behavioral health liaisons. I promise if we could get one in every school, we would see a dramatic shift like you're speaking about. Our partnership with the Department of Education, Lori's here today, and how we've been working in tandem with her and Beth to try to see how we can target those schools that are most in need. So expanding that. The other piece is the governor put together a $250 million trust fund through which we're using the earnings, the interest earnings that got approved in December by the trust fund to be able to put those into schools where we are saying you have to have the sign-off and coordination, collaboration, partnership with your local school district, principal, superintendent, whomever might be in that area. Those two things are what we're really focused on, but I can't say enough about what you and Dr. Noland are talking about in the real life and how it is impacting and making things better so that kids can succeed. Your story, again, shows that you can take something that might look hopeless, somebody being hospitalized in college, and then turn that around because of what you do to wrap around and have that person fully succeed. I mean, I'm just really happy to be up here, Senator, with you all. This is wonderful. Thank you.
Commissioner, you're connecting the dots. Right?
I mean, I know. I'm like, dang, this is awesome.
Dr. Noland, so I think a lot of times in conversation about mental health and student success, so much of the maybe broader conversation has been focused, rightfully so, on younger students. We heard some of the data around suicide rates for middle and high school students. But this is a huge challenge on college campuses. I was actually talking with my brother-in-law last night, who is a physician, and he was talking about the experience he had in med school and the challenges that a lot of members of his cohort had in that experience. And you shared some examples around what East Tennessee State University is doing. Would love for you to share anything that's top of mind for you about what you'd like to be doing next, new opportunities that you see on the horizon around how to support college students in post-secondary institutions in particular.
One of the things we found post-pandemic is students are coming to the institution really lacking in basic life skills. The ability to work together in teams, solve problems, have a sense of financial literacy and how to navigate from literally A to B when there's an obstacle presented. So we are beginning to incorporate life skills into all of our 1020 courses, which is the introduction to college. We're embedding this into the manner in which we compel students to get engaged across the institution and across the community. So our regional accrediting body, SACS, requires us to have a quality enhancement plan. Our QEP is focused on community engagement and building life skills in students. So we're starting to incorporate this into courses from the freshman year all the way through into med school. But if there was something that I'd like to see us have the ability to do, is to better use technology to help serve students. How can we meet students on their terms with technology, and then how can we wrap that technology in a way that can prevent a disaster? We have several spaces on campus that have been identified as threats. So we've enhanced cameras, we've put signage, but we had a situation 2 weeks ago where there was a student whose roommate was concerned about them that we were able to track with their phone. And we tracked this student to the space where a year and a half ago a tragedy had occurred. We were able to prevent an incident because we were able to use technology to meet the needs of students. So if I had a wish, it would be to take that technology and put it to great utilization to serve students proactively, but also to serve students during a time of crisis.
Yeah, great. Senator and then Commissioner, I want to spend a little bit of time on the Mental Health Trust Fund, which I think is just such a huge focus and commitment investment the state has made in this space. But maybe, Senator, starting with you, why do you feel like that investment's so important? What have you seen from that investment so far? And I want to maybe piggyback on what Dr. Noland started to move us to, which is sort of where do we go next? And to the extent that you'd like to share anything about what's top of mind for you around where we go next, feel free to share.
For sure. Well, I mean, a budget is a moral document, right? And so a couple of years ago when the governor decided this was a priority and to set aside these funds, and that was particularly when we had a surplus, so don't ask for that this year because you will not get it. But to have the foresight to set those funds aside, the first disbursement has been approved. I think it's about $6 million. So it will kind of set I guess in perpetuity until whenever this is, if it is dissolved, a dedicated funding source. I wish it was more, but I think that this is a good start, right? I mean, to go from 0 to 250 is a big deal. For me, ideally, I would like to see, one, you really want the groups that are already doing the work to kind of get this support that are, in my mind, that are so integrated in schools and integrated into the community that a child doesn't even, there's no stigma, right? Like, it's like, this is, you know, just like you scrape your knee, oh, you know, I have a little boo-boo, oh, I'm having this type of day, or I need this type of support. So it's so ingrained in their basic existence that there's no stigma. It's just like, this is what's going on, I need to get additional help. I think also for me, a lot of that goes around school discipline, because many children who are, you know, acting out or who are not behaving properly, a lot of that has to do with what's going on at home. You know, how many ACEs can you count that they have, and what sort of meaningful interventions you're having to kind of change that trajectory. So I would love to see that. I mean, obviously, like, I think if you look at the rate of just even counselors or nurses to student ratio, it's insane. And I know that, you know, again, but we have to prioritize certain things. There's only so much money, but I see a world where, and it starts in school, because you can't change just outright what happens at someone's house, right? You want to be able to do what you can, but you can change the experience that they have. And I'm not saying making teachers do more. I'm saying have additional supports so that the students can have what they need. And it's so ingrained in the culture that it's not even something that's stigmatized.
Great. Commissioner, any other thoughts on the Mental Health Trust Fund, and then also what you'd like to see next from your vantage point as well?
Yeah, so when the governor called and spoke to the Commissioner of Education and myself and said, I've got this idea, we're like, okay. And he said, I want to put together a $250 million trust fund dedicated for behavioral health and wellness for kids across our school systems. I about fell out. I'm like, okay, did I hear you? Did you say 250 million? Did you say 25 million? Did you say 250 million? Nobody's done that in this country. There's not another governor. As you said, it's a moral document. No other governor has put that much money and said we're going to dedicate this trust fund. So as it relates to that, it's pretty phenomenal to be part of something that's been established and will go on as long as the legislature continues this. And can't say enough about the dollars that will go out and really help kids and families across the state. As it relates to expanding things, the other thing that Dr. Sparkman brought up was the transportation issue. We realized, and I've been in the field for 33 years, starting in Memphis as a case manager, working with individuals that were homeless, struggling with mental illness and substance use. All these years we've been focused on how do we create a transportation plan. I worked with the city bus, I worked with carpool, whatever, churches, how can we do this? And it finally dawned on us about 6 years ago, well, what the heck? We're not going to solve the transportation issue, but what if we did mobile rural clinics that go into underserved rural communities? As you all know, that's been a huge focus of the governor's. And so we have been able to fund those and seeing huge success with that across the state. So our ability to do more innovative outside of the box, where you're not investing a lot of dollars into bricks and mortar, but you're investing them in very high quality, high outcome type activities. Our issue and what we're doing with telehealth around that is very important, especially in schools where you might not have a bricks and mortar mental health provider, but you can do telehealth. So those two things, doing more to go to where the people are, as well as really utilizing the abilities we have with telehealth and other services.
Great. All right, we're at our last question, and Director Sparkman, I'm going to start with you, so you can be thinking about as I'm asking this question. We'll just go this way. So obviously our goal today is to bring together many different stakeholders who are working at the intersection of health and education to focus specifically on student mental health. And you all represent leaders in our state from many different vantage points, whether it's policymaker or local leader or an institution leader. And maybe final question, would love for you to reflect as a Tennessean. Maybe you could take your actual hat that you're wearing every day off and think about your role as a Tennessean. What do you want to see our state do next in this space? We heard some data, we heard the research, we know where the challenges are. We've heard some, I think, inspiring examples of what's happening right now in our state. But what do you aspire for us to do next in supporting student mental health? What would you like to see us do? What would you like to see your peers do, to the extent that that's something that is top of mind for you as well? And Director, I'll
Yeah, so I just go back to the fact that we do have a governor who has seen this as a major priority and has reached out and set aside funds. And I think that's super important. I think it's a first step. One of the things that we haven't talked about, especially in schools, was coordinated school health. I have a great director, and that's one of the reasons we're able to do the things that we're able to do. But I reach out and talk to the students. I reach out and talk to the parents in the community, and I say, what do you need? And I think that the more that we do that as a group, we're going to find out what they need. They're willing to talk to us. We just have to ask the right questions. And so that's one of the things that has been able to enable us to build the resources that we have gone after, the grants that we have sought based on the needs that we have. I create a mental health Monday memo, and I stole this from another superintendent, so I'm not saying I'm the genius, but I send that out to teachers every Monday.
Wow.
Our mental health for our teachers is just as important as it is for our students. And so we try to reach out to our principals and say, do you have anybody who looks like they're struggling this week? And we have a list of things that might motivate them that they turned in at the beginning of the year. And so my coordinated school director will go out and might get them flowers or their favorite candy or a drink, and they don't expect it. The principal has just shared with us that they're having trouble. We also know that about our students, and we've tried to become a trauma-informed school as well and gain training. So I guess when you ask me what do I want, money is always wonderful, but I think the people themselves will tell us what we need. And then we have to try to put together the resources to push in on what those needs look like. If we want to be a successful state and we want educated children, whether that's through CTE or college, we have to meet the whole child's needs, and I'll continue to come back to that. But we also have to meet the needs of the adults that are in our school systems as well.
Great. So I know it's probably hard to take your senator hat off in the middle of legislative session. But as a Tennessean, what do you want to see next? What do you aspire for?
Well, I would like to see us expand Medicaid so that people can have mental health services and preventative care. As a state employee, I have excellent insurance. If I have any sort of crisis, I know that I will be able to see about myself. However, I think so many people in this state don't have that safety net. And at this point, to me, it's beyond politics. We are one of the few states who has not expanded. The tax dollars that everyone in this room pays goes to another state. So I'd like to see, and it's a bipartisan discussion. It's not, we are very far removed, 2 administrations removed from the passage of the original legislation. So that's what I would like to see. I think it would be transformative for communities, especially communities where their health providers, their hospitals have kind of shut down and they don't even have access to care.
All right, Commissioner.
I would like, as a citizen, to make sure that we're investing in things that work, that have proven outcomes, that you can say we did X and we got Y. And that way we know that our dollars, because they're precious and few and far between, are going to areas that are making a difference for our kids.
Great. All right, Dr. Noland.
I would hope that we could begin to focus on elements from a P20 perspective in education, knowing that students who are moving through elementary school now have learning loss as a result of the pandemic, and how are we adjusting our teacher education programs, our counseling support programs, our mental health programs to better assist those students so that by the time they get to higher education, they're ready for the rigors associated therein. I also would like to see us continue to focus on the challenges of rural communities, particularly from the space of addiction. So many families in our region are struggling with the challenges of addiction, which then magnify. And then you find yourself in a position where you're not able to help that child of a family realize their dream. You know, selfishly, it's April. And April on a college campus is an interesting month because everything comes to a close. And I would hope that colleagues across the state would ensure that their vice presidents, their deans, and their faculty had gone through trauma-informed training so that as you move through the close of the month and those pressures are coming to bear on students, that you're looking at that from a trauma-informed perspective, because I think faculty might make different decisions if they had a better sense of the challenges that their students were facing.
I feel very just honored to be in this conversation with these four leaders. Thank you for the work you're doing for students in our state. And will you all join me in thanking this amazing panel?